areas of friction, مكانات الاحتكاك بالجلد, and where the sweating is excessive, the sweating gland activity. وين يصير التهاب بصيلة الشعر في هالمكانات. And you can see this is a picture of folliculitis here. We have another word called furuncles and furuncles. These are small abscesses in the hair follicle. Folliculitis was infection, inflammation in the hair follicle. Furuncles, abscess formation at the hair follicles. It could be one abscess, could be many. So solitary or multiple. When it becomes multilobulated, this abscess become with many lobes extended over the area. It is called carbuncle. So a furuncle is a small abscess, while carbuncle is a large abscess. And you can see here, this is a picture of a furuncle. Many of you have seen such things in your body or friends or relatives. Impetigo or pyoderma. What is impetigo? These words are very important. Although they look simple, and they are simple, of course, and understandable, but you have to know which is which. Right? So, impetigo or pyoderma, initially there is a small vesicle. حبة صغيرة vesicle. Vesicle, it means papule with the fluid. Okay? Vesicle is called. Rupture with skin erosion, and then the fluid will be coming out. It's serous exudate. This fluid, once it comes out, it becomes dry. It is a honey colored crust. تتيبس تصير زي القشور. لونها لون الهونey. Okay? And you can see the picture here. This is the impetigo. It is superficial skin infection. It is very contagious. معدي جدا. وراح نرجع لها بعد شوي. Okay? So this is impetigo. There is another word called erysipelas. What is erysipelas? Now we go deeper in the skin. We are until now superficial. Now it's spreading infection of the deeper layers of the dermis. Now we come deeper in the dermis, plus edema, erythema, pain, fever, lymphadenopathy due to infection, right? Now this erysipelas has to be compared with another condition that we will discuss. It's called cellulitis. Erysipelas is more superficial. The lesion is more raised and demarcated, محددة, than cellulitis. And you can see this is erysipelas. It is streptococcal infection. I will come back to it. You can see diffuse erythema and the swelling of the face. It is caused by group A, streptococci. And we'll come back to it. Cellulitis, we go deeper than the dermis. What is deeper than the dermis? The subcutaneous tissue. So cellulitis is acute inflammation of the subcutaneous connective tissue. Swelling, pain, marked by constitutional manifestation. It is not a skin infection. It is a subcutaneous infection. So this is cellulitis. Now we have acne vulgaris. شو acne? حب الشبع. Is inflammation of the hair follicle and the associated sebaceous gland. You know, the hair follicle, as we know from urology, is connected with sebaceous gland, right? So it is inflammation of the hair follicle and the sebaceous gland. While in folliculitis, we say it is inflammation and infection of the hair follicle only. Now, this table shows you the important organisms that cause each type of the infection that I have mentioned. I want the first microorganism only from you. The first microorganism. أول بكتيريا من كل جروب. Okay? Impetigo, a group isotryptophobe. Folliculitis, Pseudomonas aeruginosa, and also Candida albicans. Right? Fungus. Acne, Propionibacterium acne. Acnes. Right? Furuncle, Staph aureus. Cellulitis, a group isotryptococcus. Intertrigo is infection between the fingers. Right? Between the fingers, especially in the food. Staphylococcus aureus, Candida albicans. فطريات. Okay? A chronic ulcer, Treponema pallidum. It can cause a chronic ulcer. Treponema pallidum is the causative agent of syphilis. The sporothrix, we have discussed the sporothrix that cause ulcers. And herpes viruses, we have discussed that also in the previous lectures. So only one microorganism, the first one from each group. Wound infection, how wound infection could occur? Surgical wound infection, right? It could be a clean, could be unclean surgical infection. Traumatic, from trauma. And physiological or endometrial. Physiological, it can occur, and we'll see how physiological wounds. Traumatic wounds could be deep cut from compound fracture. Compound fracture, the bone comes out of the skin. It is called compound fracture. Frostbite necrosis. تبع البرد. اوكي؟ يعني يصير ليجن نتيجة البرودة الشديدة. الصقيع. اوكي؟ ثيرمال بيرن. الحروق. هذه انواع التروماتيك wounds. Sources of wound infection, from where the infection comes, either from the body itself, own microbiota, or from infected individuals or carriers around the patient, or from the environment. What are the common microorganisms for each type of these wounds? I want also one microorganism, the first one from each group. Trauma, Clostridium. And you remember, we have put for you Clostridium perfringens with the car accident, etc. Okay? Surgical, clean, Staph aureus. Surgical dirty, also Staph aureus. And others, of course. But I want you to know the most important microorganism. If you want to read the others, read them. Please. Burns, Pseudomonas aeruginosa. Remember, in burns, Pseudomonas aeruginosa, and also Candida albicans. animal bite. أجلكم الله عقد cat or dog. Okay? Remember, Pastorella maltosita. Okay? So you have to know animal bite, Pastorella maltosita. If you would like to know these microorganisms that you are not familiar, just Google it, and you will get 2 words, 3 words about it. Yeah. Not more than this. So let us start with the microorganisms that I have mentioned them in the beginning, and we'll talk about diphtheroids. These are non-pathogenic corynebacteria. You know there is Corynebacterium diphtheria, which causes diphtheria. But diphtheroids are non-pathogenic microorganisms. Commensals where in the pharynx, nasopharynx, distal urethra, skin. Okay, that is why we are studying them. They're called diphtheroids. And you can see them here in the picture. These are gram-positive, aerobic, non-spore forming, bacilli or rods. Okay? Gram-positive, non-spore forming. And you can see the arrangement of the microorganisms. These are, when grown on a blood agar, they show small non-hemolytic colonies. They cannot cause hemolysis in the blood agar. They are sensitive to gram-positive. So you have to choose antibiotics which affect the gram-positive. Penicillin, cephalosporin, erythromycin. These antibiotics can affect the gram-positive bacteria. Staphylococcus. You know Staphylococcus, these are gram-positive, cocci. From the name, Staphylococcus. They are cocci, rounded. They arrange in a cluster, زي عناقيد العنب. Okay? Clusters. They are catalase positive, coagulase positive. If they are coagulase positive and can cause beta hemolysis and can grow on mannitol salt agar, they are Staph aureus. So Staph aureus are what? Coagulase positive, 1, hemolytic, 2nd, grow on MSI and change it to yellow in color. You can see it. This is Staph epidermidis. It's not mannitol fermenter. Staph aureus is mannitol fermenter. That is why it changed the color of the medium from purple to yellow. So the characteristic of Staph aureus, and there are other characteristics, of course, but the most important here for the purpose of this lecture, they are coagulase positive, hemolytic, and can grow on MSA. Treatment Staph aureus, as you know, will produce beta-lactamases. Most of them, about 85% of them, will produce penicillinase enzyme or beta-lactamase. نفس الاسم ترى بتحكي penicillinase أو تقول beta-lactamase. نفس الشيء, okay? So most of them resistant, and we call them methicillin resistant Staph aureus. Methicillin, you know, it's antibiotic. Some people pronounce it as methicillin. Okay? Okay, methicillin resistant Staph, or called MRSA. What is MRSA? Methicillin resistant Staph. So these produce beta-lactamase, and they are penicillinase So you have, if you want to kill them, you have to use antibiotics which are resistant to the beta-lactam. And we have given you these antibiotics previously in your general microbiology. Vancomycin should be used for MRSA, right? And also we can use anti-staphylococcal soap, just as disinfection. So you can see the cluster of gram-positive cocci. This is the staphylococcus. From gram stain, we cannot tell it's aureus or other species. Epidermidis, saprophytica. We can say from a gram stain, it is staphylococcus only. But with the help of other tests, for example, as mannitol salt agar, okay, we can tell whether or coagulase test or hemolysis on a blood agar, we can tell whether it is aureus or not. So you can see this table about the Staph aureus, Staphylococcus epidermidis, and Staphylococcus saprophyticus. The only one which is coagulase positive is aureus. That is why I said aureus is a characteristic characterized by coagulase positive. Toxins produced, alpha toxin is produced by aureus. Super antigen that can stimulate T cells excessively is produced by Staph aureus. Where we see Staph aureus, anterior nares, يعني على حواف الألف, okay, and perineum. Also they can cause biofilms. They can cause boils. الحبوب اللي تظهر على الجلد بأنواع. It contains pus. Okay? UTI, urinary tract infection, it usually doesn't cause. Deep infection can cause pneumonia, osteomyelitis. Osteomyelitis التهاب العظم يعني. Abscess formation, remember abscess. Staphylococcus aureus, we say it is pyogenic microorganism. What is the meaning of pyogenic? It can produce pus, right? And can cause toxic shock syndrome, TSS. And I will come back to TSS in a moment. Epidermidis, also present anterior nares, skin. Biofilm, they can cause biofilm. I discussed for you the biofilm is a growth on surfaces. For example, they can grow on the surface of catheters, urinary catheters. Also, deep infection, device colonization. And if you put a device inside the body, it may colonize that device. For example, mechanical heart valve. Saprophyticus, present in the gastrointestinal tract, can cause urinary tract infection. Remember this. And we will come back to this point when we talk about UGS. Others, variable, and also they can cause device colonization. Clinical capsule, Staph aureus can cause acute, aggressive, destructive, pyogenic lesions. And the most common Staph aureus infection, the boils. And you may see painful lump in the skin, abscess in the skin, which has necrotic center. It may go deeper. They can go to the lungs, to the kidney, to the bone, and cause destruction of that area. And when you see such infections, you should always ask from where? من أين أتت? You have to find the source of infection. Such infection, when it goes deeper, it goes high fever, systemic toxicity, and may be fatal only in a few days, because it is dangerous microorganism and resistant to many antibiotics. Now, Staphylococcus aureus, as I said, it can produce some toxins. And symptoms like diarrhea, skin rash, desquamation, multi-organ effect, it comes with toxic shock syndrome, TSS. As I said, we will come back to it. Also can produce enterotoxin and can cause food poisoning. And I have discussed to you this point when we have talked about a GI tract module. Please later on. ايه؟
في طلاب قاعدين يسولفوا مع بعض مش عارفين نركز.
تعال يمي والله. لما اسمع.
خلاص دكتور وصلتوا من المعلومة.
شو يقول؟ أنا ما شفت طالب.
لا ما وصلش عندك دكتور.
أنا ما شفت طالب أو أنا ما لاحظ. Please, students, you have not to interfere with your colleagues, right? أنتوا طلاب سنة ثالثة مو سنة أولى أول يوم، صح؟ أخذتوا 3 سنوات من أصول المحاضرة وهذه أنه please انتبهوا خميس الأحمر. If you don't stop, I will let you out of the lecture. Yes? No, any student can talk or laugh or any conversation is forbidden. Please. Your colleague is complaining from you. So you can see here this is a lesion here, a furuncle or a boil, and you can see the infection here in the hair follicle, and then the hair follicle will produce pus around it, and then the pus will become larger and larger, and it may break out of the skin. This is a carbuncle, and we said carbuncle is a furuncle but multilobulated, become larger, and this is the carbuncle picture. There are 2 syndromes. We have discussed toxic shock syndrome, and now there is staphylococcus scale skin syndrome in neonate. لو تشوف هاي الصورة تقول هذا الطفل محروق كأنه ما حرق، هو مو محروق. هاي staphylococcus aureus infection. It is called staphylococcus scale skin syndrome. This infant has a stab. You can look to the breast here, it contains, as if it contains pus. And the pus containing a staph aureus. From there, it invaded the body and caused this as if you have put the child in boiling water. So I will come back to the staphylococcal scaled skin syndrome اللي شرحته هذا 4S, right? And toxic shock syndrome, TSS. The 4S is characterized by red blistering skin, فقاعات, okay? Looks like burn or scale, الجلد مقشر. It is caused by two exotoxins, epidermolytic toxin A and epidermolytic toxin B, from toxigenic strains of staph. So it is caused by epidermolytic toxin A and B. This is the 4S syndrome. The TSS, the patient shows fever, rash, skin peeling, يتقشر أيضا الجلد, and low blood pressure, symptoms of specific underlying infection. There is underlying. As I said, you should ask from where, right? It is caused by toxin 1 super antigen. You remember in the table, I said the Staph aureus produce super antigen. What is this super antigen? Can cause excessive T cell stimulation. So, stimulating numerous T cells. This can be triggered by menstruation, tampons يعني الحفاضات, okay, that can enhance the toxin production from the Staph aureus. So you have to know these conditions, and you should be able to differentiate between them. Streptococcus, again, gram-positive cocci arranged in chains. Again, the Staph cluster. الستريبتوكوكس زي السبحة، خرزات واحدة بعد الثانية. They can cause different types of hemolysis. Alpha, beta, and gamma. Alpha partial hemolysis. Beta, complete hemolysis. Gamma, no hemolysis. You know these from your general microbiology. And there is Lancefield antigen classification, which you group them into groups A, B, C. Until now, it is valid, although there is now a new classification which is genetically based. Example of group A, Streptococcus, GAS, beta hemolytic. So, GAS can also cause toxic shock syndrome. فإذا هل تعلمنا شغلة ثانية؟ Toxic shock syndrome can be caused by the Staph aureus and can cause by group A, Streptococci, which is called sometimes Streptococcus pyogenes. Treatment, penicillin G, erythromycin, not aminoglycoside, like gentamicin or etc. Or amikacin. Streptococci are naturally resistant to aminoglycoside. So you can see the chain gram-positive. These are Streptococci. تمام؟ بس ما نقدر نقول هذه A ولا B ولا A. هذيك by other investigation. This is what beta hemolysis. This is the colony. Around it there is a clear zone of complete hemolysis of RBC present in the agar medium. Right? A clinical capsule group A streptococci, which are called streptothrone. تعلم جروب A streptococcus بتساوي tonsillitis التهاب اللوزتين and it causes a throat infection. Right? كثير من زي ما حكيت لكم المرة اللي فاتت, some of colleagues ask you what is the most common cause of tonsillitis. Some students cannot answer this. It is caused by group A streptococcus. Okay, Streptococcus pyogenes. Commonly, not always. So it's an acute infection of the pharynx and tonsils. It may produce fever. واحد يصير عنده التهاب اللوزتين شو يصير عنده؟ خاصة بالأطفال. Fever, painful swallowing, ما يقدر يبلع. Okay? Sometimes skin and soft tissue can be infected, and this is range from pustules, which is called impetigo, as I discussed, to severe toxic and invasive disease as toxic shock syndrome, which may be fatal in a few days. In addition to the acute infection, it may be responsible for some damages that occur not directly by the microorganism, but due to immunological mechanism. For example, rheumatic fever. Rheumatic fever, antibodies formed against the streptococci, and these antibodies can attack the heart and the joints and the kidneys in acute rheumatic fever. So we can get acute glomerulonephritis, which is started by streptococcal pharyngitis. Propionibacterium اللي لها علاقة مع حب الشباب, right? A gram-positive aerotolerant anaerobic bacilli هي anaerobic ولكن تتحمل القليل من الأكسجين. يعني مو strictly anaerobic مثلا الكلوستريديوم. صح؟ It's part of the normal skin convention. ولهذا السبب associated with acne. هي موجودة أصلاً على السكن. Live in and around the sweaty gland, sebaceous gland. حكينا بالأكني hair follicle infection with the sebaceous gland infection. It is linked. We are not saying it is the cause. Look to the word linked, associated with acne. It is facultative anaerobic. يعني تتحمل القليل من الأكسجين. Slowly growing in culture takes about 6 days or more to be cultivated. So slowly growing. فاللي مثلا يشرف على مختبر تروح على التكنيشن يقول لك والله ما في جروث. لازم انت تعطيه معلومه للتكنيشن تقول له اصبر عليها في اسبوع زمن وراح تشوفها ان كانت موجوده. Treatment طبعا الجرام بوزيتيف, so you have to choose erythromycin, tetracycline, clindamycin, other fluoroquinolone, cephalosporin, and antimicrobial chemical. تعرفون المستحضرات ضد الأكني أنواع كثيرة موجودة في الصيدليات. So this is the Propionibacterium acne. Okay. So they are gram-positive, anaerobic bacilli. Okay. Mycobacterium. You know we have Mycobacterium tuberculosis that can cause tuberculosis. We have Mycobacterium bovis, Mycobacteria from كثر من الأفكار، ولكن اليوم راح نتكلم على مايكروبكتيريا of the skin. So we have Mycobacterium marinum. cause skin granuloma. photochromogen. صفتها هاي الميكرو اورجانيزم photochromogen، يعني من نسوي لها كلتشر and exposed to light. photo يعني light. It can produce yellow, orange color on light. لو سمعتوا انتم photochromogen بمعنى ايه؟ They produce yellow, orange colonies when cultured under exposure of light. They live in water and they are present in fish. Mycobacterium ulcerans can cause severe skin ulceration from the name, ulcerans ulcer. Right? It is environmental tropical microorganism. Tropical يعني بالمناطق الحارة. Mycobacterium leprae سبب مرض الجذام. اوكي؟ وراح ناخذها مع الCNS. Mycobacterium, it can cause wide spectrum of clinical picture, from being a small lesion which is called tuberculoid, يعني localized, to lepromatous lesion, which is widely spread. So it ranges from tuberculoid to lepromatous lesions. And this, why sometimes localized, sometimes spread, it is related to the number of CD4 cells, T cells, present in the lesion. Localized, we have many T cells. In spread, low numbers of T cells. لأن ما في مناعة. And the treatment is by a drug called Dapsone and rifampicin. These are a few words for the time being, and then when we come to the CNS, we will have the details. This is lepromatous leprosy. You can see the lesion excessively present on the face, and there is loss of the eyebrow. يفقد الحاجب أو الحواجب. How to collect samples from the skin? By dry sterile cotton tip swab. This is كلكم شايفين هذا ستيك وفي رأسه قطن. طبعا هذا القطن بمواصفات خاصة يعني. ولكن it's called the dry sterile cotton top rubbed on the superficial skin, a blister or dry skin lesion or pustule, and you take sample for culture. And you have to be rapid in culturing it, otherwise it will dry and you will not get growth. Moist swab في ميديا بأسفل التيوب هذا. تشوفون الميديا؟ هذا مثل مرطب يحافظ على المايكرو اورجانيزم. So the swab can be taken from mucosal surfaces such as inside of the mouth. Aspiration. You can aspirate a lesion. You can aspirate a pus. You can aspirate a fluid. So aspiration of a fluid or pus from a skin lesion using needle or syringe. Lastly, a skin biopsy. As you know from your pathology, biopsy you can take a small snip of skin and you can culture it, or you can stain it, okay? So you can find the microorganism. This is the swab. This is the end of it. Any questions?